Hello, everyone, and thank you for attending the Memorial Health Virtual Job Fair event. I would like to introduce you to Megan. Megan will tell you about her company, job openings, and how to apply for those openings. Megan?
Hi, so I am Megan Nelson. I am the sourcing manager with Memorial Health System with the recruitment team. So I've been with the organization 6 years, have a lot of knowledge about the recruitment process, the different positions that we have available. So feel free to ask questions as we go or at the end. Why don't we start with an overview of Memorial Health System? We are one of the largest health systems in central Illinois. We have 5 different hospitals under our umbrella. That's Taylorville Memorial Hospital, Abraham Lincoln Memorial Hospital, Passavant Area Hospital in Jacksonville, Decatur Memorial Hospital, and then Memorial Medical Center in Springfield. We also have the Memorial Physician Services clinic system that falls under our health system, as well as Memorial Home Services, which includes both home health and hospice services, and Memorial Behavioral Health. Those are really kind of the big buckets of services that we have. So with that being said, our team does recruit for all of the positions at all of those locations, with the exception of physicians. There's a separate group that handles physician recruitment. Our health system as a whole is about 10,000 colleagues. We've been around since 1897, which I think is kind of exciting. And really, we're very focused on our commitment to community responsibility, doing what we can to improve the health of the people and communities that we serve. That's actually our mission statement, is to improve the health of the people and communities that we serve. I would say from an overall organizational standpoint, big highlights about Memorial: we are very employee focused. We put a lot of weight and effort into supporting our staff in various ways, whether that's professional development, further education, even just career growth. I think the best example of that is that our CEO actually started as a floor nurse. He started his career in nursing. So I think it says a lot that you can stay with the same organization for the entirety of your career and go from frontline caregiver up to CEO of the organization. I really think that says a lot. I also really think that speaks to the way our organization is led. Our leaders understand what it's like to be working with patients and to really be in those frontline roles, and it shows in the support that they give us. As far as positions that we have available currently, we have a variety of positions available. Right now, I would say the majority of our positions are either clinical and patient-facing, so things like nurses, respiratory therapy, CNAs, things like that, or we have a lot on the support services side of things, so that's going to be our environmental services or housekeeping, food services, patient safety monitors. We do have some clerical kind of front desk positions available as well. Those typically are going to be patient service specialist positions with our Memorial Physician Services clinics. The positions I would really like to focus on today, just kind of highlight, the big one is our patient safety monitor. This is a new position to the health system, something that was created in this era of 2020 and everything that goes with it. The patient safety monitor is responsible for the safety of a patient in 2 really distinct or different ways. It could happen in 2 very distinct ways. First way being monitoring or sitting with a patient that cannot be left alone for whatever reason. So that could be a patient who's dealing with some sort of mental health crisis, a patient who's a danger to themselves, maybe a patient who's a fall risk and is continuing to get out of bed. There's a lot of reasons that a patient might need to be monitored. The other side of the coin, or the other safety monitoring practice, is around our COVID-19 precautions. So ensuring that really everyone who's coming in and out of whichever unit you're assigned to is following the right procedures, following the right policies, wearing the right protective equipment, really doing everything that we can to protect ourselves and our patients. So that's one of the big positions we have open and available that we're kind of featuring. We do also have environmental services positions that we're featuring right now, available at both our Springfield and Lincoln locations. And then we do have patient service specialist positions at all of our Springfield and Chatham locations. So that's going to be some of that front desk and call center staff at our clinic locations. As far as applying for positions, I believe our website is on here, but you can go to jobs.choosememorial.org. We'll bring you to a nice homepage. There's a search bar right in the center. You can put keywords for what you're looking for, or you can just click the Work With Us button and it'll bring you to a search page. On that search page, you can filter by city that you're looking to work in, category of job you're looking for, whether you're looking for full-time, part-time, or per diem, just to really kind of help you filter and find what you're looking for. I think I saw something come up in chat about entering any questions. So you can feel free to start putting those in there. Really, the only other thing I wanted to note about is our application process and kind of what that looks like right now. We are not doing any in-person or on-site interviews right now, again, as a part of our safety precautions. So once you submit your application, you'll receive an email from our recruitment team. Either if we're moving forward with your application, you would receive an email stating, asking you to schedule a phone interview and asking you to enter online reference information. From there, you would schedule a phone interview with the recruitment team. If we moved forward from there, we would typically send your application to a manager for review. And then again, if we move forward from there, we would schedule you for an interview with the manager. That interview could be over the phone or via video, like we're doing right now, depending on the manager and kind of what capabilities we have. But like I said, there are no in-person interviews at this time. The other thing I'd like to make sure candidates know is that you will hear from us either way. Even if your application is not a fit for us at this point in time, you will hear back from us, so that there's no just kind of lingering and waiting.
Fantastic. Thank you for that overview and presentation, Megan. For the folks that are on this webinar, you can see in the chat section, I've also provided the link to the Memorial Health Employer booth, and at that location, there'll also be, as you can see on the screen, job information listing or linking you, to current positions that they have open. As you see, there's also a website listed there that you can peruse and kind of get more information about. As far as employer contact information, Megan, what email address would be the best to send any sort of direct inquiries that folks might have? Would it be your personal or general email?
We have a general email address that multiple members of our team monitor, so you'll get a much quicker response than if you're waiting for me, unfortunately. So that is the word careers, AT Memorial, @MHSIL.com. I feel like I have to spell it out because there's @ in there, and I'm putting it in the chat right now just for everyone. So it is careers @Memorial @MHSIL.com. And I did see that we got a question that came through. So how has the culture changed over the last 9 months? That is a great question. I think it's evolving every day. And I would say the big things that have changed are, I think the pace of the work. I mean, we went from being very slow in the months of March and April when things were shut down and we couldn't do elective procedures, but COVID cases weren't very high in the area. So honestly, it was slow around here. Census is very high. We have a lot of patients. We've got a lot of patients on all of our units. We're back to doing elective procedures and things. So it's busy. And I think the stress level is a little bit high, again, just given all the external factors. But the one thing that has not changed is the support that our organization is providing for our employees, both in terms of making sure that we are safe and that we have the right equipment. They're even giving us with our masks at every entrance. We're screened at every entrance. We have the opportunity to buy really cute memorial masks now if we're not in a patient-facing role where you really need the medical grade masks. But not only that, the organization is really placing an emphasis on making sure that we take time for ourselves and that we're focusing on our mental health. It can be very, very stressful. So really we're putting out, the leaders are putting out messages about ways to get some of that relief, ways to decompress, lots of messages of support, and even things like that patient safety monitor position I mentioned. It is critical that we have enough of those people in the hospital at any given time. So if we're short on a shift, rather than making the rest of the team absorb that, they've put out calls for volunteers from other departments so that other departments can maybe pause some of the work that's a little bit less critical and go help where it's needed. And I think that, again, that really says a lot about how this organization can shift in these just completely unknown times, but still remain supportive of each other. Did that answer your question? I hope so.
Thank you, Megan. And if you do have any other questions for her, please feel free to enter those into the chat. If not, we can kind of pivot to some of the general questions that I have. And Megan, you're familiar with this process, but we'll just run through it again. Can you kind of elaborate on how long your hiring process will take from the point of submitting an application to being hired?
Yeah, I would say honestly, the only thing that changes the length of the process is the candidate's availability and the manager's availability. So really at each stage of the process, we can move as quickly as availability allows. So if we try to schedule a phone interview and you're not available for a week, that's going to take us a week, right? We typically try to keep our hiring process within a few weeks. So I mean, I had applicants come through last week for positions that are starting on 11/2. So it can really be a pretty quick process. What areas are we seeing more open positions than usual? A lot in those support services positions. So like I said, the patient safety monitor, it's new, it's something that we need. New positions in environmental services, again, just around new, different, extensive cleaning. I mean, we have to make sure that we are doing the things that are safe. So those departments are really seeing an uptick. And then we are seeing an uptick in a lot of our call center positions, those front desk positions. Again, we're trying to do more telehealth. Patients are doing a lot more calling in to ask questions instead of just kind of showing up for an appointment or at Express Care. And we need to adjust for that.
Thank you, Megan. And for the positions that you highlighted here today, are there any sort of educational requirements that anyone would have to possess?
For the patient safety monitor and support services, typically we'd say we'd prefer to see a GED, but it's not required. On the clerical patient services side of things, we do require a high school diploma. And typically we look for those positions to see at least a year of prior office experience, preferably in a medical office setting, but at least a year of clerical experience to really help you kind of hit the ground running, so to speak.
Thank you. And are there any options for working remotely? And if not, if the positions aren't with you, would they be able to be linked to perhaps maybe another recruiter that is hiring for those types of positions?
Yeah, so the positions that we highlighted, kind of those support services, patient-facing roles are not remote, but we do have positions that are remote. So, I mean, a lot of our office positions are working remotely. Some of our clerical type positions that are more on like maybe medical coding side of things, those have the opportunity to be remote. It's really something that as you work through the recruitment process, you can speak with the recruiter and the manager about. I would say the way that we're handling remote work is really on a level that works for each individual in each department. We're kind of steering away from making blanket statements because there are things, there are things that each person needs, and it's really hard to make a blanket statement about that. So you won't see positions posted as remote on our website, but those are always questions that you can ask.
Fantastic, thank you. Another question that I have for you, and I believe you kind of briefly touched upon it, but maybe we could go a little bit more in depth, is what are some of the standard benefits that you can, expect to offer if you're, given an offer for one of these positions? And then also, could you elaborate maybe on some of the fringe benefits that is offered by your organization?
Yeah. So as far as standard benefits, we do have two different health plan options. One that's kind of your standard premium plan, and one that's more of a consumer-driven. It's a consumer-driven health plan, so it's got a higher deductible, which means less out of pocket per paycheck, but you would pay more for your care when things happen. So you can kind of judge, based on your situation, which you think you would need. We do have benefits communication specialists, which I think is a really cool feature of our organization that meet with each new hire within their first 2 weeks. So before you really have to cement your benefits in stone, to make sure that you're picking a plan that works for you and your family. They really walk you through the different options and what kind of the cost models would be. It's very helpful. On a personal level, I had a baby within the last year. So I was able to sit down with them and say, oh my goodness, obviously everything's changing for my life. How do I need to change my benefits? So it's a very helpful thing to have. We do also have options for dental insurance, vision insurance. We've got some of the other optional insurances around, critical illness and accident. We've got a hospital indemnity policy. One of the other things I think that sets our benefits apart is our Memorial Choice Program. So if you are an employee at Memorial or you're covered by a Memorial insurance plan, any physician you see that is in the Memorial Network, the Springfield Clinic Network, or the SIU Network, there is no cost for a visit. So there's no like copay or deductible just for an office visit. And there is also a set of labs and a set of imaging tests and things like that that are also at no charge as long as you're within that network. So we do have a document that kind of lists all those things out, but it's kind of another nice benefit that we would have. As far as the fringe benefits, I mentioned some of the educational reimbursement and things like that that we have to support you throughout that process. We do also have what we call My Benefits Hub. So it's kind of a discounts and deals and things like that that are accessible to our employees. It's a website you can log into. We have an employee health program, so things to really help you if you would like to improve your health coaches, things like that. And we have a partnership with the new Y downtown. So this is a new one that I don't have a whole lot of information on, but what I know is that we have a partnership there and that there will be some benefit to that.
Fantastic. Thank you, Megan. And another question that I have for you that a lot of folks ask is, can they expect to be paid for the time that they're being trained, assuming that they are hired?
Yeah, so once you're employed, you're paid for the on-site work. So any training that would happen on the job, that is paid time. The only things we would have you do prior to starting would be like your employment paperwork. And that time is not paid, but that's, paperwork to get started.
Understood. Thank you. How can a candidate stand out and get an interview, assuming they are qualified?
Yeah, so I would say the big things, as long as you're qualified for a position, we want to talk to you. I mean, we do a lot of phone interviews. We really do want to talk to folks. So I would say the big things are make sure that your resume and application are very clear so that when we are looking at it, we can very clearly see your work history. We can see dates and timelines. We can put together a good picture of who you are. The other thing I really like to tell people is less is more sometimes when you're trying to stand out. So like I said, make sure we can get a clear picture of you and that it's not muddied by things that aren't relevant. We do want to see your full job history. So if you have jobs that, maybe lasted a year or so, but you don't feel are relevant, still put them on there if they're within the last 5 or 6 years so we can kind of see what your work history has been like. But if you have like volunteer activities or community activities or things like that, that might not necessarily be relevant to the position, you don't necessarily need to put that on a resume. It can kind of muddy your work history or what we're trying to look at. If they are relevant to the position though, put them there. Because again, that's helpful. We want to see what kind of qualifications that you have. The other thing I would say is just honestly pay attention to your email and your phone once you've applied for a position. We get a lot of people that apply and then maybe don't reply to emails or don't answer the phone at a scheduled time. And that is something that'll get you knocked out of the process pretty quickly. So do pay attention. And I tell people also to check their spam folder. A lot of employers use electronic applicant tracking systems. And depending on the email service you use, sometimes our responses might go to your spam folder. So if you are actively job seeking or you've put in an application, I would say just check that folder once a day to make sure that you're not missing anything from an employer.
Thank you, Megan. And then a final question that I have for you is, what are the opportunities for advancement within your organization? And then any sort of success stories that maybe you can personally attest to?
Yeah. So I think it depends a lot on the growth path that you want to take, right? So we see a lot of folks that start maybe in environmental services or food services, wind up getting a CNA certificate and moving into that patient care kind of role, maybe even moving on to a nursing role. I mentioned that our CEO started as a floor nurse, which I think is a great story. But one of the other ones that I like to talk about, one of our nurse managers, she started here as she was in high school and she attended our teens interested in nursing camp. And then she went to school to be a nurse. She started as an intern. She started then as a CNA. Then she was a new graduate nurse. Then she was a nurse manager. I mean, she's really just moved through the ranks, so to speak. And I believe she's actually got a master's degree now through the organization. So it really depends on what you're trying to achieve But we also have an organizational development team and a career counseling center within that helps our employees figure out what that path is and what kind of steps they need to take.
Fantastic. Thank you, Megan. And I just want to reiterate, if you do have any questions for Megan, you can enter those into the chat section. We'll get those answered for you. In the meantime, Megan, I would like to give you an opportunity kind of before we end today's session to give any sort of summary statements or just cover anything that maybe you feel that you might have overlooked.
I think we've talked about a lot. What I would say is submitting your online application is the great first step. If you have any additional questions, let us know. Yeah, I think that's what I have.
And again, I just do want to highlight that a link to Memorial Health's employer booth has been included in the chat section, as well as an email where you can direct any sort of questions that you might have regarding the application process. I would like to thank everyone for attending today's session. Have a wonderful day. Thank you very much.
Thank you.